Our presenter today is going to be Ann Abbott. She works for the Iowa Center for Evaluation Research at the University of Iowa School of Social Work. So she is an East Coaster who loves her time in Iowa and is really a pro evaluator that we're really lucky to have in the cancer world. We really appreciate all her work that she does. But she's here with us today to kind of talk about performance measures, those dreaded things that we always are working on at the beginning of the year and the end of the year. So she really does have a lot of great experience here, and I think she's going to talk a little bit more about just kind of her objectives for the day and then kind of how we're going to go ahead and take questions. So I think with that, Ann, I think we're all ready to go if you want to go ahead and get started.
Okay, great. Well, thank you, Rachel, for that introduction and for setting all this up. I always love working with the Cancer Consortium because not only are they incredibly professional and amazing at what they do, they also make my life very easy. And I've definitely done webinars before that have not been so easy for me. So big shout out to Rachel and Kelly and the crew. So welcome, everybody. It seems like we have a very robust group today, which I'm really excited about. And I'm sure people will have questions and comments as we're going along, but I'm going to ask that everybody hold those till the end. We are going to do kind of a traditional Q&A, but, I do want to be able to build off other people's questions, and if people are going to ask the same question, to kind of answer those at once so we can get in as many as we possibly can. So Rachel has volunteered that if you are listening through your speakers, you can type your questions through the chat and we'll address those at the end. And then also if you're joining us by phone, you'll be able to ask on the line, I believe. So it is now 12:02. So for our people that are late to the party, we're going to go ahead and get started. So Rachel will have the slides up on the Cancer Consortium website after the fact. She has my whole slide deck, so people will be able to access this after the fact if you need to go back and ask anything. And I have my contact information at the end of the slide, and if anybody wants to email me. I am going out of the office for a week, but I'm usually pretty good about getting back to people. So with that, we'll get started. Okay, so to begin at the beginning, what are we even talking about today? I put up some definitions for some of you who might be new to this topic, and for those of you who just might want a quick refresher. So the larger topic of performance measurement is what we're going to go over a bit this afternoon, and more specifically, building performance measures that work well for your organizations and your programs. So performance measurement is really about answering two big questions. One, what am I trying to accomplish? And two, how do I measure my progress and or success? And I'm sure all of you can think of many different ways to ask this question, but that's really what most of the questions will drill down to. So to that end, what are performance measures? Well, at a very basic level, performance measures are a mechanism that let us know how we did or how we are doing at a given task or set of tasks. They can contribute to a wide variety of organizational programmatic goals, which also means they can be single or multi-level, which is what I think trips a lot of people up, but we're going to go over through some of that today as well. And, lastly, they can be your enemy or they can be your friend. And today we're at least going to try to make them our friend, and if not our friend, maybe at least a frenemy. So, is performance? Okay, so Doug, I saw your question. We're just going to answer at the end, so just so nobody thinks I'm ignoring them. Okay, so why do we care about performance measures? Well, maybe everybody in this group today just really loves to measure their performance and just wanted to, talk it out. I have a feeling that's probably not the case. If you're like most people, you probably have some mixed feelings about performance measures, so I think it's worth going over why these things are useful. So for starters, and at the risk of being too direct, but honest, money. Very few foundations or other granting institutions are going to give you money if you cannot quantify your success in some fashion. We'll get into this in a little bit more detail later because there's a good way and a not so good way to do this. And there are performance measures that you would want to broadcast to something like a public fundraising campaign, and those may be different than what you would want to use to drive programmatic success or report to, say, somebody like the feds. But for now, let's just consider that measurement is, in general, pretty good for business. Secondly, unlike this cake fail picture, without measurement, it can be difficult to tell if things went right or wrong. For instance, let's say you run a program that teaches ninth graders about STDs or STIs. If you cannot demonstrate that, is your program really helping those ninth graders? It's really only a guess. Keep in mind, anecdotes are good, but humans are very, very susceptible to hearing what they want to hear and blocking out the rest. So if you ever find yourself saying things like, well, I just know my program works, or, I don't need data, you're probably in trouble. It's true that not everything is measurable, but really most things you just need to get creative and you can find at least some way to measure them. Thirdly, if we don't measure something, it gets awfully hard to tell when something went right versus when something went wrong. Let's say that same program I just mentioned for ninth graders, for teaching ninth graders about STDs, has a really awesome instructor one year, and the youth in the program really learn a lot. They know everything there is to know about STDs. If we weren't measuring their knowledge gains in the first place, how would we know that? Conversely, if there was a not-so-good instructor, we wouldn't know that without measurements either. Lastly, and yes, this is not just a bit cliche, but very cliche, but it is annoyingly true. What gets measured tends to get done. So why is this the case? Well, I tend to think there are too many explanations for this kind of occurrence. One, if you're measuring something and being held accountable for that measurement, you're inherently going to pay attention to it. You have to. This is actually the principle behind so many things. Think about on something like a weight loss program. Most require you to document what you eat or your levels of hunger during the day, and this is because awareness really is the first step. Here's an example. Maybe out of habit, I ate a cookie after lunch every day. Because it's such a habit, I really don't even think about it, but once I have to start writing that down, I realize that crap, I actually eat a ridiculous amount of cookies in a week compared to the average person. Or maybe I start tracking how many calories are in different types of cookies, and I realize it's okay if I have an oatmeal cookie, but the double chocolate chunk is really putting me over on calories. Measurement makes things visible, noticeable, and real, and allows you to change things accordingly. The second reason that things that get measured tend to get done is because things are getting measured, that usually means they have been actively articulated to a wide range of stakeholders. When people know what measures they're supposed to be tracking, of course they're going to focus on those more so than what's not getting measured. So up here I have what looks like some pretty simple steps. These 6 steps are the kind of generally accepted steps to performance measurement. Something I want to highlight today is that these steps really require very different amounts of time and effort to be dedicated to them to make them effective measures. So, and apparently I can count on one slide but not the next one. So these 5 steps that are really 6 steps, apologies for that. To create really meaningful performance measures, you should really be spending the most time thinking about your desired outcome or accomplishment, which is that first step I have highlighted in that kind of ugly color orange. Now, that may not make any sense right now, but as I go through this webinar, I hope everyone has an understanding of why this first step is really the thing you need to be spending the most time on. The rest of these steps do involve some time and resources to be dedicated to them, but the truth is that all of these steps really depend on you getting the first step correct, and the first step actually involves a couple more steps, which is what I'm going to be leading you through today. Most of today's webinar is going to be focused on this and how paying attention to this step will help everything else fall in line. Rachel, I'm getting a little bit of feedback. Is that on my end, or?
I don't think so. So if we have folks joining through the phone, if you would go ahead and mute your lines by pressing *4#. And I'm going to go ahead and put that in the chat tool as well, but just so that we don't get any feedback.
Okay, great. I just get paranoid, so thank you for that, everybody. So if people do have questions about these other steps that I don't go in as far in depth to today as you would like, maybe you feel like you've got this first step really covered, feel free to shoot me an email or ask a question at the end. So when we are creating performance measures for organizations or programs, it's important to keep in mind that performance measures can and do measure a wide variety of things, and this goes back to that previous slide I was just on about identifying your desired outcome. So I've listed out some of the most common things that people tend to measure, both when they're looking at organizations as a whole and at programs. But really, this isn't an exhaustive list, and different programs will characterize things differently. So don't let this list limit you, is my point there. I think it's a good starting point, but if you want to measure something else, I think it's good. But these are kind of the really basics. These are the things most people are going to want to measure. And just generally, I think most people are the most interested in measuring effectiveness. It's just one of those words. Everyone at least wants to be effective in theory. The key here is that everyone will define effectiveness, as well as some of these other categories, really differently. And any performance measurement system you set up will only be capable of tracking any one of these things as you define it. So all of that leads me to part one of step one, which I know sounds scary, but we'll get through it, so don't you worry. Where we start with the performance measurement process is at the beginning and the very first step of the 6 steps. So to determine what our desired outcome is to start with good definitions of everything in your organization, starting with your organizational mission and vision, which is that outer loop of that onion diagram looking thing, and moving down into smaller things like program goals and objectives. I don't have an example of a logic model up here today, but I know a lot of people, just talking to some of the other stakeholders within the Cancer Consortium, I know a lot of people are using them. This is where you would use your logic model to really drill down into what are your program objectives, how do those feed back into greater organizational goals, how do programs work together, that kind of thing. You cannot pick, create, or form good performance measures without tying them to your organizational mission. Your organizational mission at its root is what you want to achieve. So it is seminally important that programming and programming strategies are linked to it, both going up and going down. Whenever you are thinking up new performance measures or even revising old ones, your first step needs to be the identification of your high-level mission and goals. You work down from there, going deeper and deeper. And I know this sounds basic, but some programs do not have well-articulated high-level goals in place, which makes it very hard to define success and or effectiveness. So this really gets back to what I was saying a couple slides ago in terms of, you really got to focus on this first step. You got to walk before you can run. So if you are the person in charge of creating performance measures, you need to have good definitions. Generally, for every program and for the overarching organization, we need to answer these kinds of questions. But if you groaned or rolled your eyes or even gave me some side-eye when I put up this list, I totally understand, because these kinds of basic questions don't really help us if we aren't thinking them all the way through. So this next one gives us a little bit more specificity, and I think gets more at the root of kind of the answers we really need. Because what we really need are very specific answers to those kind of general who, what, where questions. This is part of having good definitions. So when we ask ourselves a question like, who are we serving, it's pretty obvious the answer to that question is more than just people. But are we talking about people of a certain age, certain income level? Maybe it's age and income level. And this will be different based on programs versus organizations, but it needs to be asked on both levels. Also, other things to consider, people with a certain strength or deficit. I used to work with a lot of job training programs, so it was very specifically targeted to people that were currently unemployed or illiterate. The point is, the more specific you can be about the answers to these kinds of questions, the better your goals, objectives, and performance measures will and can be. So with that in mind, we're going to be working through an example today, and apologies for those of you who haven't eaten yet. So we're going to demonstrate a few points, and I want to introduce everyone to my favorite organization to do that, the Coalition for Cupcake Reform. Now, this example is going to be a bit oversimplified, but just stick with me. The Coalition for Cupcake Reform, or the CCR as I like to call it, is a new organization. The individuals that formed the coalition want to quote-unquote, improve cupcakes in the mythical land of baked goods landia. So if we start the process of creating some performance measures for this organization with just this information, and we begin with getting our definitions for mission and high-level goals, what do we know? Well, I see the mission printed on this slide is to improve cupcakes for the citizens of baked goods landia. So I have the beginning of an answer for the who and maybe a sliver of the where question. But what about the rest? What does improve cupcakes actually mean? If I was someone thinking about supporting this organization, I need to know. It turns out the CCR only wants to improve the physical appearance of cupcakes in baked goods landia. They're not worried about changing the taste or the nutrition of the cupcakes, which is frankly what I would be more concerned with, but not my organization, so we'll leave it be. Now, I don't want to freak people out because it's okay that that information about the CCR's focus is not written into the mission statement, but it's very important to know. I or anybody else in the organization cannot create good performance measures without understanding that the CCR only cares about the physical appearance of cupcakes, and it gets more complicated the larger the organization you're running. Sometimes even high-level stuff is not written down or advertised, so you have to do some digging. Usually staff and management have an understanding of these things, even if they aren't formally articulated, but that's not always the case. Either way, whoever creates the performance measures needs to have an understanding of these goals. Moving on with the example, let's say something like the board of directors for the CCR decide that there are 3 primary problems with the way cupcakes are currently made that are contributing to them looking bad. 1, people mix the batter incorrectly. 2, people bake the cupcake incorrectly. 3, people frost cupcakes incorrectly. Now, in a perfect world, all programming is based on real needs, evidence-based practice, and existing research. So let's say all of those things in Baked Goods Landia lead to the board of directors' conclusions about this programming. So the CCR will have 3 divisions, which are those divisions up on the slide: the mixing division, the baking division, and the frosting division, that are going to confront each of these societal ills. The board also decides that each division will confront its respective issue by hosting educational activities and producing promotional materials for their specific area of cupcake improvement. So going back to our list, we have a bit of a program model and some of why for the overall organization, which means we can move towards creating program measures. Which brings us to part 2 of step 1, which is to divide and conquer. Now, this will be different for every organization, and I'm sure people are going to have a lot of questions about this step because this is usually where people start to get hung up. Theoretically, given the CCR's focus on 3 somewhat distinct areas, each division should really have its own performance measures that are all contributing to the organizational mission and high-level goals. That's why it's so important that those things are well-defined. But we also need well-defined roles for each of these divisions to create meaningful performance measures for the individual divisions. So this is what I was saying in the beginning about things being multi-leveled. All this leads to part 2 of step 1 for creating performance measures, divide and conquer. If you have a smaller organization, maybe it's just one program or a few similar programs that are driving towards the same goals, you probably won't have to do this step, or at least won't have to go as in-depth with it. But for this example, we're going to take the mixing division specifically and come up with some performance measures for them. So the loose goal of the mixing division is to provide educational opportunities and promotional materials to the public. I mentioned this briefly before, and I don't want to go too deeply into this, but it's important that programming is based on real needs, evidence-based, and research. In this example, those things are a given, but so many times they are not, and I just wanted to make a note of that, it's always good, especially when you're writing performance measures or going and doing some strategic planning. It really opens up some program review stuff about why you're operating the programs you're operating and to really go back and refresh that kind of stuff. So let's say that the government of Baked Goods Landia comes out with a report that says the problem of mixing cupcake batter incorrectly in Baked Goods Landia is really occurring in the population of 35 to 55-year-olds. Older people happen to know an older technique that actually works well for them, and young people use a mixer, so they don't have to worry about it. So the mixing division is really, their high-level goal is to improve the mixing techniques of 35 to 55-year-olds by providing educational and promotional materials. So, okay, so we're going to keep drilling down and going through that onion thing. So so in this drill down, our only focus on one objective, and this is educational opportunities. So this is where it becomes incredibly important to distinguish program outputs from desired outcomes. Both are important. Now the program objective is to provide educational opportunities, but we have to remember our organizational mission is to improve the physical appearance of cupcakes. So we need to measure both outputs and outcomes that contribute to that larger goal. So to do this, I went back to that list of what types of things can be measured. Like I said earlier, you should have goals that don't quite fit. If you have goals that don't quite fit within those, you can add other subdivisions, but be careful because it can get more complicated. The point with this is that you should be measuring both activities or milestones that get done, which are outputs, and progress made towards your larger goals, which are your outcomes. You'll see in the very last line of the quality category that it just says long-term. Well, I left this blank for a good reason, and that reason is I couldn't think of any data sources that currently measured the physical appearance of cupcakes. Unfortunately, there is no cupcake census, and if there is, I'd be shocked if I didn't know about it. So this is where my example falls quite short, but there may be real-world instances where you just don't know or don't have a data source. Sometimes programs are measuring things that there's not census data about, there's not BRFIS or HEDIS data about, there's just sometimes not a data source out there. And in those cases, you kind of have to either create your own instrument or you're only able to measure a shorter term outcome. In those cases, there are things like in terms of creating data sources, there are other things. So, at the last, I was at a Cancer Consortium meeting a couple weeks ago, and we were talking about adding a question to the BRFSS and what data that would give us. So that could be an option. So I would encourage you, if you think there's not a data source for something you're looking at, to really think through that comprehensively in terms of what data you can get your hands on. Because there is a lot of data out there to be explored, and oftentimes you might be surprised what actually does get collected. So finally, we get to step 2. We're off of the parts, and we're just straight on to step 2, which is identifying the performance measure that you will use to determine success. So I listed the components of our performance measure up here. And we have an indicator, which is the change to be measured, a unit of measure, which is how the indicator is quantified, baseline, which is your starting reference point, which you've probably got to guess by the word baseline, and then target. So I'm just going to put this up in a little different form on this next slide. So sometimes putting it in table form is helpful for people so it just helps them break it down. But this is a pretty basic example. Usually I like to leave room for a numerator and a denominator, even in final charts, but as long as you have the data, you can leave it as a percent in a table. Sometimes just writing things out in those bullets I had in the past slide isn't easy, or people don't get it. I think the table form is better anyway. I think I do want to mention, though, these are just the short-term quality indicators you'll notice, but this is just for you who are more visual. That's why there's not long-term. Theoretically, you would have long-term up there. Moving past this visualization, though, now we're going to move into steps 3 and 4, which we're just going to go through pretty quickly and then get a little bit back to step 2. But this example is kind of easy because the organization is new and there really is no baseline, which could very much happen. I'm sure you can all guess that maybe that happens in the real world, but I wouldn't, it does happen, but not that often. You may have a new program or something that wouldn't have a baseline. But in general, you should have some kind of general idea what you're going for with your number. Maybe it's another organization. Maybe it's, just like I said, you based it off of research, so you have an idea of that way. Try to get a baseline in there any way you can. If you are doing your own research about something, and like I said, you're not going off a data source, it is okay to put unknown in when you're when you have a baseline and you just don't know, but I would always provide a pretty good justification as to why you don't have it or weren't unable to get it, but it does happen. Obtaining a baseline can also be really tricky if you're working with an unfamiliar data source, but I would say in general the biggest thing to know about obtaining a baseline is someone at your organization really needs to have a good understanding of how the data is being collected. Let's say you want to use let's say BRFIS, since I already said that as a data measure. If you don't really have a good understanding of what that data is and what it's actually telling you, it can get very, very tricky very quickly. Also, you'll notice for this example, I just kind of guessed at a target. This is something that happens in real life, especially, again, new programs. You're not really sure what your target needs to be. Now, in the case of grants that come down for programs, you'll usually have some sort of, so let's say you got a federal grant, they will usually tell you what they want your targets to be. So if I got a grant from Office of Adolescent Health and they said, we want you to teach this many, we want you to teach this many teenagers with this amount of money and you have to hit these program goals. So in that case, it's actually kind of easy because somebody is telling you what they want you to do. But when you're creating it yourself, you don't always know what your target should be. And I think the biggest thing about it is sorry, I'm going on to the next slide. Your target should be reasonably attainable. And I think that what I mean by that is that you really have to talk through an organization or the people that are going to know what the actual organization is going to be doing. I think the biggest mistake people make is, sometimes evaluation staff are very siloed and segregated from people actually doing the programming. That's certainly not always the case, but I've seen it happen a couple times. And, they just come up with these targets out of nowhere and say, 80% sounds good. But if you're working with an especially high-need population, or it is a newer program and you're not really sure what barriers you're going to run into, that's really problematic. And if you reported to all your funders that you were going to hit a target like 80% and you only hit something like 50 or 60, it's just misaligned expectations. The second thing that output and outcome targets really should be is, as I already said, really based on research and pre-existing data. This is perfect. If you're going to run a new program, I think the number one thing you can do is talk to other people who have run like programs before. If you have data from a similar program, I know sometimes based on federal or state funding sources that people have a program for a while, it goes away and then it makes a resurgence. If you can find old data about that, that can also be very helpful. I already touched on the fact that, it should really be agreed on by program staff. I think any of your frontline direct service workers should be involved in setting good performance measures, always, 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 which can be a pain, but I think it pays off in the end. And then, the last two things, they should be revisited or negotiated often. So let's say you're working with a homeless youth, for instance, who are a really tough population to work with, you should be looking at those measures and saying, like, okay, what is realistic? What did we hit? What do we need to change? Using them to drive performance, but also looking at if your performance measures are really your problem and not your driver. And then also, in general, I just like to use percentages instead of absolute numbers. So I'm just going to go back a couple slides to this identifying performance measures slide. So the indicator is the changes to be measured. And you'll notice these next two I have that you can put an absolute number or percentage in. In general, I like percentages, especially for long-term performance measures, because things change, especially if you've got like a 5-year grant or something and you say your long-term outcome is that you're going to affect, let's say, 50% of the 14 to 17-year-old population. If you put a certain number in there, and then, your funding changed or something moved around, that's tough. You do have the same problem with percentages. I just, in general, tend to think percentages can be a little bit more flexible when you're working in performance measures. So that's just kind of a personal thing and something I like to do myself. Okay, going back. Oh, went too far. Apologies if I'm making people sick with all this slide turning. So if we look back at our initial 6 steps, all we really have left to do is 5 or 6, which really have less to do with building the measures and more to do with reporting. I could give you guys some pointers on how you actually gather data or where you look at for data, but I think that may be the subject of another webinar, and then also reporting and analyzing. I'm sure, I'm not going to do a starter on Excel for y'all. So after all my yapping today, I do want to leave a lot of time for questions and Q&A and back and forth. But what I really want everyone to come away from at least this slide deck presentation with in terms of what a good performance measure is it defines success based on a mission and mandates. And if I want you to take anything away from today, it's really that, having your mission and goals and definitions for all of those high-level things in your organization is the most important thing to having a good performance measure. Another thing about a good performance measure is it can tell the story of how a program affects the external environment, and that's part of tying it to your mission. As I said, it should be divided into short, medium, and long term. I think that's a mistake a lot of people make, is terms, they do short-term performance measures, which sometimes also look like outputs. And we can talk about that a little in the Q&A because people usually have questions about that. But, you should always have to at least the point you're able to, short, medium, long term. And even if it's not working in the real world, you should at least be thinking in that kind of theoretical performance measure time frame. And then the last thing is really going beyond outputs. Social programs should measure social outcomes. Health programs should measure health outcomes. If your performance measure is just that you held an event, that's not really a performance measure if it's not contributing to anything greater. I think the big thing, a lot of people confuse things like outputs and outcomes. Like an output expires, or it's something like an activity or a milestone. It expires when you do it. It's a check-the-box thing, versus a performance measure is something that you're constantly looking at, revisiting, trying to get to. It's about continuous performance measurement. So I told you I'd put up my details for anybody that wants to get in contact with me. I am equally likely to answer you on any of those mediums. So with that, I think we'll go to questions. And I've seen some people typing in some stuff. So Rachel, maybe we'll take some questions from the sidebar real quick and then go to what people want to ask on the phone.
Yep, that sounds good. And I was going to say I can just read. So Doug Beardsley had the question towards the beginning of the webinar about is performance measurement the same as performance management, or could you describe the relationship between the two?
I certainly can. And Doug, I'm offended that I did not get the good buddy that Rachel got. But I forgive you, and I will answer your question anyway. So the big difference, performance management is really about, I think performance management is really the process of looking at your measurements. I think it's about looking at your performance goals and deciding that if you did or didn't hit them, what needs to be changed. I think of it as more as administrative as opposed to measurement is really the process of going through and finding, well, sometimes qualitative, but quantitative measures for what you are doing, if that makes sense. And feel free to tell me if I skirted your question, but I think I answered it.
And I had typed in a question. I didn't know if there was some sort of like, when you meet with contractors or something, is there some sort of golden ratio between short-term and long-term goals for a specific project?
Yeah, I think it really depends on the length of the project. If you've got a year project, I would say you want to go more so on the short-term goals because you've got a much shorter time frame and you're really trying to get a bunch of things done versus if you're doing something like a 5 or 10-year project or you have 5 or 10-year goals, you do want to be looking at those long-term goals. I think the big thing is tracking data around long-term measures is much harder. It's much more time-intensive. It's more resource-intensive, and you can only track so many just because you're going to run out of your ability to track your long-term stuff.
There's a question typed in from Daniel Hoffman-Zinnel. He said, I'm working on a work plan template given by a funder, and they include outcome objectives, output objectives, and activities. Mm-hmm. Have you seen this before, and how would you separate each one to make the plan effective?
Okay, so it's outcome objectives, output objectives, and what was the last one?
Activities.
Right. So yes, I have seen something kind of similar to that before. I think the big thing is I know that's probably just the order you typed them, but I would flip the order that I'm thinking about them. So as I said, activities are very important, but activities are just things that you do. Activities are really could be closely tied to output. So if you have an activity, let's say it's something like a health fair, that's great. You're going to put in your work plan that you're going to organize this health fair, and we're going to do this and this and this and this, and these are the activities we're doing to achieve the output of conducting the health fair. But what is the actual outcome from the health fair? It's probably increasing people's knowledge about health, or maybe you have more specific goals. Maybe it's a teen health fair, and you want to do stuff around specifically, let's say, obesity prevention. You want to tie your goals to what your actual project are, and that goes back to just being really specific and not so nebulous in your goals. Your objectives should never say anything like improve health. So I don't have the specifics of your project, but I think things do get organized in that. I think the big thing is, like I said, activities are something that you could check off a list. We did this, this, and this, and this. Outcomes are not something that you're able to just check off a list like that.
I think you had touched on this, but Diana von Stein had asked, could you explain the difference, or could you explain how outputs and outcomes are different?
Sure. So let me see, go back in my slide deck a little. 1 second, Diane, and I will answer your question, I promise. This is baseline. Okay. So the difference between outputs and outcomes is it is tied to what I was just saying about activities. Outputs are things that got done. So let's say, so for today's webinar, my output was that I completed today's webinar. The outcome is that everybody on the webinar might have just the slightest chance of knowing a little bit more about performance measures. So outputs are really things that happen and things that you do, versus outcomes are the effect of the things that you do. Outcomes tend to be much larger, and that's kind of why, they get divided into the short, the medium, and the long term. Sometimes what I find helpful to do, because even I sometimes am in the thick of something and get confused about it, if I'm writing a grant or I'm creating a new logic model, I'm thinking through a new program, it's easy to get hung up on these things. What I try to do is go back to what I was saying in the beginning about tying it to the mission. So if I have a program in front of me and I say, okay, what is the mission of this program? I can usually find the high-level outcome in that, and then work my way back down from there. So output should be on your lowest level, if that makes sense, to help identify them. Okay, good. I'm glad.
She said that helps. Okay, good. So I think that takes care of all of the chat questions. So I don't know. I know we have a few folks on the phone. So if you want to unmute, you can just push the same buttons here. So you do *45# to unmute, so I can type that in. But does anybody have any other questions over the phone? And I guess, Anne, maybe while you're waiting, I know that you work with a lot of chronic disease programs, or just a lot of programs that aren't.
Yeah, a couple of them are.
Yeah, well, and I mean, they just have really long-term objectives. So yeah. I didn't know if you can share any best practices or questions that you often get from them that might be helpful to the group that maybe you've helped troubleshoot them through.
Right. So I think what Diana rightly so just asked is a lot of people get hung up between this idea of outputs versus outcomes. I think especially when you're talking about things like events that require a lot of planning and a lot of resources, so much does go into stuff like that. So, something like a health fair or something like a conference, and people just, I think people are just so determined to be like, this was an outcome was that we did this health fair. But, I think that's something really people have a hard time getting past, because you put a lot of work into something and then you don't necessarily, you're not seeing the forest through the trees. So I think that's tough. I think another thing is, when you're creating performance measures, what I was saying a couple slides, let me move back in. Like I said, creating targets can be really hard, especially if you've got a kind of a bureaucratic management structure, and I don't necessarily just mean government. I mean any kind of large social service organization. Performance targets are tough, and people's jobs are sometimes on the line about whether they are hitting their performance targets or not. So how you negotiate those targets can be very, very tricky. I think the other thing is too, it can be hard to kind of think through your actual data measures. So the slide I'm on right now, I said the quality indicator for it was the percentage of 35 to 55-year-olds reported that they liked the class. So that would be done, and this is something we're doing, actually, I think Terry Meek's on the line, and this is something we've been working with her a lot on, because she had to create her own data source for a project, in that she wrote a survey, and we had to use the data from that survey. So I think that's the other thing, is people get kind of bogged down occasionally, and when they see something like a data source, they assume it's something that already has to exist, versus sometimes it's something that you have to go out there and get, and that can be really awful and time-consuming, and it'll suck up a lot of your energy and time, but that's your data source. If it doesn't exist, you have to go out and get it. And Terry's done a really great job of doing it herself, but I think that is something in general people tend to get hung up on, is where do I find this data? How do I know this? And that goes back to those two questions I asked at the beginning, is it's, how do I know what I know, and what am I actually using to measure it?
Oh, so Anne, I'm not seeing any more questions from the group, so I thought I'll just take this time to put up your slides so that folks
Okay, great.
can download that. So if you want to just go ahead on the phone, under the Files tab, I have Performance Measures, meaning the PowerPoint. You just highlight it and click Upload File, and you should be able to download it right to your desktop. So any other questions, or else I think we'll adjourn a little early.
I've never had such a lack of questions. I don't know if it's because I explain things so well or explain things so badly.
I think everybody wants a cupcake is what
Oh, yeah.
I think it is.
It's
A cupcake and a nice
danger.
walk. So, well, and thank you, Anne, for all your expertise. And I know you'll probably have a lot of folks follow up with you, too, after the webinar, which I think will be really great. So, well, one thing that I am going to do in the spirit of evaluation is I'm going to push a SurveyMonkey survey that you all can take. So if you go ahead and do that, I think it just takes about 2 minutes. That would be really helpful. But other than that, yeah, if you have any other questions, maybe Anne, you can stay on the line for a few more minutes. But
Sure.
Otherwise, we'll go ahead and adjourn. So thank you so much.